Hi everyone, my name is Kristen Brown and this is a teaching video for Nursing 305 Informatics with the Lock Haven University RN to BSN program. My topic today is about DVTs and PEs. What you know can save you.
Some of the things that I'm going to be talking about today are the basics about blood clots, DVTs, PEs, the differences between DVTs and PEs, risk factors, signs and symptoms, diagnostic tests, treatment, and prevention. Let's start with the basics. What is a blood clot, DVT or PE? Blood clots can occur when blood thickens and clumps together from various reasons. For example, clotting disorders, stagnant lifestyles, dehydration, pooling of the blood in the extremities, poor diet, and genetics. A DVT, or deep vein thrombosis, is a blood clot that forms within a vein deep within the body, usually originating in a calf or a thigh. A pulmonary embolus is a blood clot in a deep vein that can break off and starts to travel through the bloodstream. This loose clot is called the embolus, which can eventually lead to a pulmonary embolus or a blood clot in your lungs. It can travel through the heart to an artery in the lungs and block blood flow, or even to the brain, resulting in a CVA or stroke. A PE is a very serious condition. It can damage the lungs and other organs in the body and potentially cause death. Blood clots in the thighs are more likely to break off and cause a PE than blood clots in the lower legs or other parts of the body, although it's not uncommon to have those too. Blood clots can also form in veins closer to the skin surface. However, these clots typically don't break off to cause a pulmonary embolus. Some of the risk factors involved are more commonly long air travel and long vehicle rides. These are the most talked about risk factors for PEs. Other risk factors include obesity, cigarette smoking, hypertension, immobilization, surgery or trauma, and dehydration. Along with oral contraceptives, more chronic medical illnesses such as congestive heart failure, COPD, and even some cancers can predispose patients to pulmonary embolus or DVTs. PEs are also a prominent women's health issue. These risk factors include oral contraceptives, pregnancy, and even hormone replacement therapy. Some of the signs and symptoms of DVTs are PEs. With the DVTs, most often originates in the calf with a persistent cramping or even a Charlie horse type feeling that intensifies over several days. It usually hurts to flex the foot upwards towards your shin and is often mistaken for a calf or muscle strain and can even be behind the knee or thigh pain. Leg swelling and discoloration or streaking may accompany the increase in discomfort. An upper extremity DVT may cause otherwise unexplained arm or neck swelling. Many patients with a PE have a vague sense that something is wrong but have difficulty defining the problem. Consequently, they often delay seeking medical attention. At times, because these symptoms are so vague and nonspecific, medical professionals will diagnose anxiety rather than PE. Some of the other common symptoms of a PE is unexplained shortness of breath. This is the most common symptom. Chest discomfort that is usually worse with deep breathing or coughing, a general sense of anxiety or nervousness, lightheadedness, or even blacking out. To fully diagnose a DVT, an ultrasound test is used to detect blockages or blood clots in the deep veins. This is the standard imaging test and the most definitive test to diagnose a DVT. To establish the diagnosis of a PE, the most frequently used test is the CTA scan. This is a CT scan of your chest using IV contrast to highlight the problematic areas. And in most cases, a blood test called a D-dimer can determine whether or not there is potential for a clot. When the diagnosis of a DVT or a PE is made, many times oral anticoagulations are started in conjunction with IV anticoagulations such as heparin that you see on this slide. There are also medications called thrombolytics, which are referred to as clot busters, and they work by dissolving the clot directly. These, however, have a higher risk of bleeding, so they are reserved for more severe cases. When When oral anticoagulations cannot be used or don't work well enough, a filter known as a Greenfield filter or an IVC filter, inferior vena cava filter, can be inserted through the groin into the inferior vena cava, which is the large vein that brings blood back to the heart. This filter will capture or trap an embolus before it reaches the lungs. While oral anticoagulations or injectable anticoagulations and even the filters are good means of treating blood clots, prevention is the key with diet and exercise changes, conversations with your primary care doctor, and anticoagulation blood tests to determine if you are at a risk for a blood clot. DVTs and PEs are serious conditions that could result in further medical complications. Know the signs and symptoms. The more you know, the safer you and everyone you care about will be. Thank you for watching.